and Conservative. I'm with Dr. Gil Milikovsky, MD, of the Alliance for Patient Safety. We're going to be talking a little bit about patient care in hospitals and errors and complications and how common they are. Good afternoon, Doctor. In a recent study, Healthgrades reviewed 37 million Medicare patients' medical records and reported that medical errors in hospitals kill 200,000 U.S. patients each year. They did not report the number of injuries or fatalities suffered by patients under the age of 65. And based on 152 published peer review articles, the Nutrition Institute of America concluded that medical mistakes kill about 784,000 people every year. Are these conditions still going on today, and has anything been done about the number of patients who die each year on medical complications?
In every industry, like for instance, if you buy a television or you buy a computer or you buy a car, you have a warranty. The product you buy is defective, you're going to return it. And if too many products are returned, you're not going to be able to survive, you're going to go bankrupt. Contrary to that, in the healthcare industry, not only you don't lose money, you do not go bankrupt, but the hospital and physicians that have more errors and more complications actually generate more revenues. So there is a financial incentive to allow errors and complications to permeate the system. The two only critical elements on which the law depends are the administrators and the governing board of the hospital. And those are business people. These are corporate mentality approach. Like any other business or any other corporation, a manager, an administrator, a CEO, COO, is evaluated based on the revenues and profits of the corporation, in this case, a hospital. No administrator of hospital is graded, evaluated, or compensated based on the quality of delivery or care provided to patients. What you and I and the audience would consider a good physician is a physician that will admit a patient only and solely if necessary. A physician that will only give you medication if necessary.
Of course. And
a physician that will have, hopefully, the least possible errors and complications. Mm-hmm. So you can go home and be productive and enjoy life with your family.
Right.
That's not a good physician in terms of corporate minds. A good physician for a corporation is a physician that produces revenues. The FBI actually was tipped into a total anomaly in a hospital up in Northern California by the name of Redding. To cut through all the details and conclude, 83% of cardiovascular surgeries performed at that hospital were not indicated. If you and I went to see him today, we both would have had a cardiac catheterization, which is not necessarily the right approach for everyone that walks through your office.
Right.
But it generates income. And you and I would both be told by Dr. Moon, or any other such physician around the country, how lucky we are to have come to his office today, because both you and I have a life expectancy of no more than 3 to 6 months. Fortunately, we have in the hospital a cardiovascular surgeon, the finest in the country. Those two individuals alone generated for this little hospital that is no bigger than this building, $40 million revenues a year.
Let's move on to this Rand Corporation report. This is from 2006. Their finding is that all adults in the United States are at risk for receiving poor health care, no matter where they live, why or where, or from whom they seek care, or what their race, gender, or financial status is. So this isn't just a low-income person's problem or a Beverly Hills problem. This is across the board. This is a threat to all patients across the United States.
It makes no difference if you're rich or poor. It makes no difference if you go to a county hospital. if you go to an HMO Kaiser or if you go to Cedars-Sinai.
But if we have hundreds of thousands of people injured by complications and errors every year, why isn't more being done about it? Why isn't Congress or the Senate getting involved in clearing this problem up?
Because the problem in our country is that money talks. And the same entities that control the hospitals also control the political arena. The debate on the issue of healthcare is not on the right platform. What do I mean? You have right now about two very passionate ideologies clashing each other. One believes very, very strongly that the solution to the healthcare industry is a single-payer model. That means basically nationalized healthcare, like England or Canada, Russia, or any other country. Mm-hmm. On the other side, you have as adamantly passionate individuals who believe in capitalism, in free market forces, and that's the magic silver bullet that will save healthcare. Now, the problem is that neither side is right, because neither side is addressing the real issue. This is an issue of who controls the quality of delivery of care. If it was true that single payer was the solution, well, then guess what? The county hospitals, the Veterans Administration hospitals, the prisons would be the best hospitals in the country. Mm-hmm. And so we should all go there. Mm-hmm. But the Rand Corporation shows that the county hospitals, Veterans Administrations, prisons and so forth, cities and so forth, does not provide you superior care.
So the commonality, the common thread in all of this is only quality of care.
Of who controls.
Of who controls the quality of care.